Welcome to SS2 Physical Education, Term 3, Week 3. Cardiac arrest kills thousands of Nigerians every year. When the heart stops, the brain suffers irreversible damage within 4 to 6 minutes without oxygen. CPR and an AED can double or triple survival rates. By the end of this lesson, you will explain the chain of survival, perform CPR correctly, describe how to use an automated external defibrillator, apply the recovery position, and manage common sports emergencies. Let us begin. The International Liaison Committee on Resuscitation developed a chain of survival, a sequence of 5 actions that maximizes a cardiac arrest victim's chance of surviving. Link 1. Early recognition and call for help. Recognize cardiac arrest. The person is unresponsive, not breathing normally, and has no pulse. Call emergency services immediately. In Nigeria, 112 is the national emergency number, Lagos 767, Abuja FRSC 0806401522. Link 2. Early CPR. Begin chest compressions without delay. Every minute without CPR reduces survival by 7 to 10%. Link 3. Early defibrillation. Use an AED as soon as one is available. Defibrillation within 3 to 5 minutes achieves a 50 to 70% survival rate. Link 4. Advanced life support. Paramedics arrive with epinephrine, adrenaline, advanced airway devices, and cardiac monitoring. Link 5. Post-resuscitation care, hospital ICU care, therapeutic hypothermia, and identifying the underlying cause. In Nigerian schools and sports venues, links 1 to 3 are the most actionable. Advocacy for AED placement in schools, stadia, airports, and shopping malls is ongoing. Follow these steps for adult CPR. Step 1. Assess for danger, ensure the scene is safe. Do not approach if you will be harmed. Step 2. Check response, tap the shoulders firmly, shout, "Are you okay?" Step 3. Shout for help, call loudly, ask a specific person to dial 112 and fetch an AED. Step 4. Open airway, tilt head back, lift the chin. Step 5. Check breathing, look, listen, and feel for no more than 10 seconds. Occasional gasps, called agonal breathing, are not normal. Begin CPR. Step 6. 30 chest compressions. Place the heel of your dominant hand on the center of the chest, lower half of the sternum. Interlace fingers. Keep arms straight. Compress 5 to 6 centimeters deep. Rate 100 to 120 compressions per minute, the tempo of staying alive by the BECE. Allow full chest recoil after each compression. Do not lean on the chest. Step 7. 2 rescue breaths. If trained and willing, pinch the nose, form a seal with your mouth, deliver 1 breath over 1 second until the chest visibly rises. Repeat once. If unwilling or unable to give rescue breaths, hands-only CPR with continuous compressions is acceptable for adults. Step 8. Continue 30 to 2 ratio until the AED arrives, the victim recovers normal breathing, or you are physically unable to continue. Hands-only CPR is endorsed for untrained bystanders. Call 112 and compress hard and fast. An automated external defibrillator analyzes the heart rhythm and delivers an electric shock if needed. AEDs are designed for untrained bystanders. They give clear voice instructions throughout. Step 1. Power on. Open the lid or press the power button. The AED will guide you by voice. Step 2. Attach pads. Expose and dry the chest. Attach 1 pad below the right collarbone. Attach the second pad on the left side of the body below the armpit. Follow the diagrams printed on the pads exactly. For children under 8 years, use pediatric pads or place 1 pad on the front of the chest and 1 on the back if no pediatric pads are available. Step 3. Analyze. The AED will instruct everyone to stand clear and not touch the victim. It analyzes the heart rhythm. Step 4. Deliver shock if advised. If a shockable rhythm, ventricular fibrillation or pulseless ventricular tachycardia, is detected, the AED charges automatically. Press the flashing shock button only when instructed. Step 5. Immediately resume CPR for 2 minutes before the AED reanalysis. If the AED says no shock advised, this means the rhythm is not shockable, continue CPR regardless. An AED cannot restart a flatline heart, asystole, with electricity. Continue CPR until help arrives. When a victim is unconscious but breathing normally, place them in the recovery position to prevent airway obstruction from vomit or the tongue. Steps: kneel beside the victim. Bend the near arm at 90 degrees with the palm facing up. Bring the far arm across the chest, holding the back of the hand against the near cheek. Pull up the far knee with your other hand. Roll the victim towards you onto their side. Adjust the upper leg so both hip and knee are bent at right angles. Tilt the head back to keep the airway open. Monitor breathing continuously. Common sports emergencies in Nigeria: heat stroke, confusion, no sweating, core temperature above 40 degrees Celsius, call 112, cool immediately with ice, wet towels, or fanning. Do not give water orally to an unconscious person. Hypoglycemia in diabetic athletes: pale, sweating, shaking, confused, give glucose, Lucozade, sugar if conscious, call 112 if unconscious. Concussion, headache, confusion, dizziness after head impact, remove from play immediately, no return to play the same day, seek medical evaluation. Asthma attack, upright position, use the patient's own reliever inhaler, call 112 if no improvement within 15 minutes. Key points: the chain of survival has 5 links. CPR ratio is 30 compressions to 2 breaths at 5 to 6 cm depth and 100 to 120 compressions per minute. Hands-only CPR is acceptable for bystanders. AEDs provide voice instructions and are safe for any person to use. Recovery position protects unconscious but breathing victims. Nigeria Emergency Number 112. WAEC examiners test CPR stages, AED use, chain of survival, and sports injury management. Practice these steps until they are automatic. One trained bystander saves lives.